mode across India in partnership with states to ensure no one is left out. I'm using his quotation. We turned it into no one is left behind, but the Prime Minister was ahead then. And the poorest and marginalized, as well as the previously unreached, are all provided and assured with tap water supply. The Government of India's total outlay of 3.6 lakh crore. For others, that's 45 billion US dollars. For Jal Jeevan Mission is evidence of this commitment. First, I would like to highlight the public health benefits for safe water, sanitation, and hygiene. Unsafe water, poor sanitation, and hygiene are risk factors for many diseases. Communities with inadequate access to water are less likely to follow hygiene practices like hand washing or use of sanitation services effectively. Many diseases such as cholera, diarrhea, dysentery, hepatitis A, typhoid, etc. can be prevented with good water and sanitation and hygiene in communities. We call that WASH. In healthcare facilities, safe water, sanitation, waste management, and hygiene can reduce hospital-acquired infections and are critical for the safe delivery of babies. Safe water contributes to a reduction of under 5 mortality. Globally, diarrheal diseases remain the second leading cause for child mortality of children under 5. Lack of clean water and sanitation is also a major contributor to malnutrition, frequent transmission of soil-transmitted helminths. Proper management of water and sanitation contributes to preventing and eliminating vector-borne diseases like malaria, dengue, and chikungunya. But more than just the health impacts of investing in access to safe water has also socio-economic implications from the time saved and improved health. Let me explain that. Having water connections in the home saves time and energy in fetching water from distant sources, especially for women and girls who are mainly responsible for collecting water. And this happens usually early in the morning. We have seen many of this. Many stories of how life in the village has changed because of Jal Jeevan Mission and how lives of women have changed. This gives more time to productive activities. It also prevents injuries and musculoskeletal disorders from hazardous journeys to collect and carry water back. In children, safe water sources improve health and school attendance, leading to long-term positive consequences for their lives. In adults, good health increases economic productivity and household income. The Government of India has done extremely well on sanitation and water with the flagships of Swachh Bharat Mission and Jal Jeevan Mission. Swachh Bharat Mission, with the goal of making India open defecation free, has reported unprecedented progress. Jal Jeevan Mission has made similar progress. The JJM dashboard shows households with tap water connections have increased from 16.64% on August 15, 2019 to around 63% as of today. I think that deserves a big hand and is testament to the work of a lot of the people here in this room and our partners and other colleagues in the States online. I have the privilege of seeing these results myself in my field visits in various states in the villages of Uttar Pradesh, Bihar, Haryana, Gujarat, etc. Some states like Haryana, Punjab, Goa, Gujarat, Telangana, and union territories such as Andaman Nicobar, Dadar and Nagar Haveli, and Daman and Diu have already achieved 100% tap water coverage. This is truly commendable. In consultation with Drinking Water and Sanitation Department, WHO has undertaken an assessment to quantify health and economic gains of Jal Jeevan Mission for various coverage scenarios. This has been done using well-established methodologies for estimating the burden of WASH-related diseases. Among the many benefits of safe water, the study looked at 3 parameters: death and disease burden averted from diarrhea, economic gains and time savings, especially for women and girls fetching water from distant sources. My colleagues will be making a brief presentation on this. And we at WHO continue to assist the Department of Drinking Water and Sanitation, Ministry of Jal Jeevan on several initiatives, which include facilitating data collection on SDG 6 on clean water and sanitation for all, as part of the joint monitoring program in partnership with UNICEF. Strengthening capacities of providers and communities for adopting and implementing water safety planning with partners. We have also undertaken a few pilots in Uttar Pradesh. Health impact estimation of Swachh Bharat mission was also done in 2018. I will end by reiterating WHO's commitment to providing technical support in this vital area and lauding the commendable investments in the prevention of other diseases and working with partners to further strengthen government efforts. Most cultures associate water with peace, happiness, health, and prosperity. Safe water is truly life-giving. That's Jal Jeevan, literally, Jal Mere Jaan. Water is my life, and so we must all really work together to ensure that it reaches every home. Thank you very much. Dr. Rick Johnston to start with the delivery of the results.